I'm Dr. Aston Goldsworthy, and I'm going to talk to you a little bit about how to avoid a total knee replacement. Now, this is the fourth video in our series where we're discussing some of the treatments now for this common condition of the knee. These are two of the most common pathologies that lead to osteoarthritis in the knee and degeneration. So, in our last video, we discussed proper assessment and then stabilization by using an offloading brace to create space in that joint. Okay, as we discussed before, we discussed that this is spongy cartilage in here and it has to stay hydrated. This meniscus has to stay hydrated to remain elastic. Okay, well, as we get older, the joint fluid that's in our knee reduces by about 10% every 10 years after the age of 30. And the viscosity, or the thickness of that fluid, goes from an oily to a watery type of fluid. And so, of course, that fluid volume decreases. And when it decreases, the proximity of the joints, decreases or increases. So they actually get closer and closer together. And so when that occurs, you have the opportunity to develop friction. And so when that friction happens, we release an enzyme actually that breaks down our cartilage and breaks down our bone. And that's how you get degeneration and osteoarthritis. So it's basically friction and some enzymes that are released that cause that condition. So how do we rehydrate this joint? I mean, how do we make this joint lubricated again so that basically the meniscus can absorb impact again without being damaged? Well, we use a substance called hyaluronic acid. And so hyaluronic acid has been around for probably 20 years, if not longer. And it's been used that long in the knee. It's FDA approved. So hyaluronic acid is something that's in all our joints. It's called synovial fluid because synovial fluid is 80% of it is made up of hyaluronic acid. So we introduce that injection into the knee. And so when it comes to injections, there's something else that's really important. The type of equipment being utilized to inject the knee is vital. Imaging. So often patients are getting these hyaluronic acid injections, or the chicken shot as some of them have referred to it, and they're getting these injections without by a physician who doesn't have image guidance. So I call it a blind injection. They're basically feeling on the knee, make a little X, and they're like, poke, and then you get that injection. Well, 25% of the time you're going to miss without imaging. And typically hyaluronic acid is a series of between 3 and 5 injections. And so if that's the case, odds of you missing one are pretty high. And if you miss it, it does absolutely nothing. It can actually cause pain and cause some functional issues in the knee for a short period of time. So at our office, we use what you call fluoroscopy. So it is a live x-ray, and you can actually see the needle going in. And then we use contrast dye to ensure placement. Because if you're not in the joint capsule, then you're not going to help that patient. And so hyaluronic acid is a very effective tool for rehydrating the joint and increasing space. And when you offload it and do that, you get an even more powerful outcome. And then you couple physical therapy along with it, you're going to get an even better outcome. So those are 3 things right there, when utilized together, can produce a powerful outcome. Now, individually, each one of those does great things, but when combined and when done at the proper intervals and the right synergy, patients get better, and they get better fast. Thank you for watching. Our next segment will discuss regenerative medicine when it comes to the knee, and in our series about how to avoid a total knee replacement.